Hey, I have a question for you. How many of you are ostomates and why? You think about that and I'll be right back. Hey, I'm back. How many of you had enough time to think about it? So, the reason why I have an ostomy is because I made the choice. I had a rectal vaginal fistula that was at the time as big around as my surgeon's finger. And with it, I became completely incontinent. It started out slowly, and by 2 weeks before I had my surgery, I became completely incontinent. Because what a fistula is, it is a connection between two organs. It can be connected from your rectum to the outside of your body. It can be connected from bowel to bowel. It can be connected from bowel to your kidneys, your bladder, your vagina, anywhere. And mine, and it's an abscess. And so over time, it barrels this hole. And I think it did it all in one day on me. And so I ended up having that. And at first, you could feel everything if anything got stuck in it. And it was very, very uncomfortable. I did many cyst baths because I was getting a lot of urinary tract infections because, of course, it had abscess from my rectum to the very, very low part of my vagina. And the way it had burrowed was, it was at a downward angle. It wasn't straight across. It was at a steep downward angle. And my surgeon wanted to do a plug because those of us with Crohn's disease, our tissue gets broken down really quickly because most of the times we have to have multiple surgeries. And so to go ahead and start having scar tissue this early on, he wasn't too fond of it. But the insurance wouldn't pay for it. They had to have the actual go in, do surgical, and all that. So I have had many surgeries. I've had the rectal flap. I've had the plugs. I've had surgeries every 3 months until 2014, and I'm pretty sure that the muscle that he left behind to help create a barrier and to close the fistula, I'm pretty sure that that has finally broke down, and I have another one because I'm having the pain that I had before. And so that was the main reason why I had the ostomy. It was to give my bowel rest. I had what was considered a oh shoot, I can't think of the name of it. I'll think of it in a minute though. A loop ileostomy. It's where they don't cut away your small and your large bowel. They bring it up and somehow they loop it over, and your bowels are still connected, but it's like a, I don't know how to explain it. So I had that from 2011 to 2014. No, to 2011 to 2013. And in 2013, I had to go back in because I had a hernia. I've had several hernias, and so I had to have an ileostomy take down and brought back up. And at that time, I had had a, it was done as an emergency surgery. So the surgeon gave me an ileostomy. He thought that it was too long for me to have a loop ileostomy. So the my surgeon was out of town, and so I had to use one of his colleagues, which is also a very good doctor. And I had seen him a couple of times when my surgeon wasn't in, and I liked him. But the resident reminded him that, Dr. Jordan was really hoping that, I could someday go back, and, well, I never did. So in 2014, I had another, I've had a couple of takedowns. I've had 3 takedowns and brought that back up. And so in 2014, I went back in again and been in and out of hospitals so very many times. It's unreal. It's like my life just had me a room. I'm coming back. So then, in 2014, I went to the hospital, and immediately I ended up getting sick. I had pneumonia. Well, having pneumonia, you can't have surgery. It just weakens your immune system that much more. And they had asked me to try the Intivio, which is what I tried last year, and it didn't work on me. And I had already been on Humira, and it didn't do anything for me. And I said no. So they did a sigmoidoscopy. A sigmoidoscopy is it's much like a colonoscopy, except the tube is much smaller and it's flexible, and it can see more and more in depth of what your colon actually looks like. Before they could even get into my rectum was extremely, extremely swollen, and they finally got past it and seen I had a lot of disease. And so then I was taken into the ER, and I had my appendix, my whole colon, as you guys know, large intestines, and my rectum and my anus removed. And then they sewed my backside up and caused other complications. I had been asking him to just go on and take it out because I'd been sick for so long and nothing was helping. I had been on prednisone or Wowsay, you name it, I've been on it, and that's where my weight is coming from. Is I'm still trying to get excess weight off that I had gained. But anyway, in the beginning, I had to choose, and my life was more important to me than anything else, so I chose to have the ileostomy in 2011. The decision, I cried. It's not something that is very easy to absorb. You're already being diagnosed with Crohn's disease, and that's not an easy disease to take in. It's not an easy disease to it's just not. It's a lot to take in, and you search the internet for answers, and every site you go to says the same thing. And at the time, I didn't have family support. I had my boyfriend at the time, and a month later after my surgery, things went down right then, and it just went really bad. And so you know, here I've got this, I finally got a diagnosis. This is what's been wrong with me my whole life, and I never had a diagnosis. I mean, my doctors were looking for a diagnosis when I was a kid, and all they gave me was a hiatal hernia. So taking this diagnosis is really, really hard, because when you look at it, and and the symptoms and the disease itself, you can cut out the disease, but the disease isn't gone, because the disease can move from that area that you cut out, and it can move to another part. Well, that part kind of resembles cancer, and so no, that's not an easy thing to take in, and there's already a long history of cancer on both sides of my family. And so that, was really upsetting. And so I chose the ileostomy. I actually cried because there was this thing on my stomach. And for the longest time, I didn't want to look at it. And your self-esteem kind of just drops, and you're not paying much attention. I mean, you are, but you're not. You're always worried that the thing is leaking. And today, I still do. You'll find me, and I'm not even paying attention. But you'll find me. I'll put my finger down in my pants or something and feel around the pouch around the ring to make sure there isn't anything there. It's just barely at all that I can catch, because I have been out and have had it to leak and had to fix it. And but whenever I first got it, I had it leak and change it 3 or 4 times right then. And when you have to change it that many times, it's very irritating on your skin. So I have every product that can be used on your skin for an ostomy. Maybe I don't use it right away, but I have it in like the paste. You don't put it on, between the wafer and the barrier. You put it on like, right after. And then it just works like a caulking. It keeps the whatever is coming out, which is usually acid, from coming out, and it will stop it. And you can wear that ring, the barrier, a little bit longer. And I've been through several different companies, and there's only one that I can use. So anyway, I finally got used to the people were saying I was too, I was not self-absorbed, or I don't know, but people can be mean. Then I got used to having it. I was no longer stuck at home like I was. I could leave. And before I had the surgery, and it got to the point to where I was incontinent, I was still making the trips to Bowling Green to, visit my parents' grave. I went to my, no, I didn't go to that at the time. But anyway, the trips, a 2-hour trip would take me 4, because I had to stop that many times to go to the bathroom. And over-the-counter medications did not slow this thing down. And so, I didn't go very far from home. I couldn't. It just took longer. So, once I got this, I would go different places, and and I did go to my class reunion and didn't have to stop, and you know, and it was great. And then I've gotten the taste of being able to go anywhere and not worry about, you know, anything, and it was a taste of freedom. And a lot of people don't look at having an ostomy as freedom, but when you are being stuck at home, having to wear an adult brief, and constantly worrying about smelling, and taking a couple showers a day, when you have this, you finally do have your freedom back. And so then I eventually just got to the point where I was like, I told my surgeon, I said, you're not taking this down. I'm not. Even if you could put it back together, I would still have loose stools, and it's just not what I want. I would want to keep my ostomy. I mean, that's just me. And so it turned out with the emergency surgery that I had to have a total proctoplectomy. And now I've also had gastroparesis, and you know, Crohn's alone has done a huge number on me and my body. And then you throw in the mix with the gastroparesis, and gastroparesis has completely turned my life around with it. And I was already restricted with some foods that I could eat and couldn't eat, and now I am even more restricted. A couple weeks ago, or maybe a month ago now, I don't remember, my body decided it was no longer gonna let me eat meat. Well, I thought it was just a one-time incident. So I tried eating meat again. Got sick. And so the other day, my husband and I were sitting there, and I can't remember what it was we were eating. It wasn't much of anything. It was just, I wasn't eating meat. What was I eating? I can't remember, pasta or something. And I got very bloated. Very, very, very bloated. And when I get bloated to that extent, it is very, very painful. It's uncomfortable. I can't do anything. I'm miserable. And so the only thing that I can actually eat without getting sick is oatmeal. And oatmeal is full of fiber. And why I can eat that and why doesn't it make me sick, I have no idea. But that I can eat that and it doesn't make me sick. But I still eat the small portions. Maybe that's the reason. And then I'm not hungry the rest of the time. I do my IV hydration now. Yeah, I wanted to talk about that too. So I've been doing IV hydration since 2014. We went to that because I was being admitted into the hospital for severe dehydration. And so I asked my doctor that before I was discharged from the hospital in 2014 if I could do hydration therapy at home to keep me from being admitted into the hospital. Because when you get dehydrated, being dehydrated causes other things to happen in your body. And people have a misconception of drinking fluids and having IV fluids. When a doctor tells you to make sure you drink plenty of fluids, that's what they want you to do. They want you to drink it. It goes, when you drink fluids, it's different when you drink fluids than it is if you are getting IV hydration. When you drink fluids, it goes down through your body, and a normal person, your kidneys will get what it needs, your stomach, your bladder, it goes through all that. with me, it just runs through and out my bag. My body doesn't absorb anything. It's constantly at war with each other, and then it's, then I put on top of that gastroparesis. So my body is at a constant war with itself and these diseases, and so the IV hydration is going straight through my veins, and I'm getting fluids where they need to be because my body's absorbing it through my blood system, my bloodstream. So anyway, so that is the difference between that, and that's why I'm on it, because I did have a lot of it. And when you're dehydrated, when you're that dehydrated, like every couple of weeks or months, you're back in the hospital because you're dehydrated. You're in the hospital because you're dehydrated, and also because you're dehydrated, that severely dehydrated, you also get nauseous and start vomiting. So that just goes into a downward spiral. So I do my IV hydration. I don't think that I'm getting enough, but I'm not going to complain. It helps me, and there are other things that I'm going to ask my physician when I see her, because I don't absorb, vitamins or minerals either, and I'm anemic. I have no potassium, I have no magnesium, which those are two of the big things, and I take them, and that's the only thing that keeps them afloat. So I am going to try to get IV vitamins that I was shooting to my hydration therapy, and then it would turn it into a banana bag. Then, excuse me, speaking about being dehydrated, then when I'm on my hydration therapy, it goes for 10 hours. And I was doing it at night, and I would wake up in the middle of the night, and I might be in such a sound sleep that I would wake up, and instead of disconnecting myself from the IV pole, I would just walk away from it, and it would jerk me back. And so, and the pole I had was the cheapest pole. It was a gray pole, that's the name of it, and it was cheap. And so I didn't really like it. And so then I just started running my IV fluids through gravity, and it was done quicker than what was supposed to be done. And so then I was trying to run through the day. Well, during the day, that ties you down. If you're hooked up to a pump, you can't do anything. Even if you're letting it go through gravity, you still can't do anything because you're hooked up to the wall or hooked up to the pole still. So, and then when you take it down to go to the bathroom or whatever, your blood goes back. If it sits lower than your head, it goes back. So, I decided that I wanted to try the backpack and whatever I needed, the pump. And so I got the pump 2 weeks ago, and their backpack is, I can't figure the daggone thing out, and it's ugly as hell. So no, I went ahead and I ordered my pump as soon as I knew I was getting that in the next day. And so I'm very pleased with the pump and my backpack, and it has given me so much freedom, and it's wonderful, and it is great. I mean, it was something that I was been thinking about and wishing that had been made, and it was just like when I seen it, I was like, oh my god, you know, that is exactly what I've been wishing that they had made. But then I knew you'd have to have some kind of a pump, because it has to sit up higher if you're just gonna let it run bolus or gravity or whatever. Bolus is actually over an hour, but if you let it go through gravity, it has to be up higher. So you have to have some sort of pump in there. And so when I talked to my pharmacy, they got me fixed. So that's how that is. I am nauseated. I'm always nauseous. I don't think it'll ever go away, because I stay nauseated with Crohn's all the time. So I don't think that will ever go away. And so I do that with my hydration, and I can see that it helps a little bit. When I had to take it off the other day, I started feeling nauseated, but you know, it's not that much that I'm putting into a bag. So I don't know. But then I give myself a dose of Phenergan at night. As soon as I lay my head down and I fall asleep, I wake up sick to my stomach. But that's all part of gastroparesis and Crohn's, and you know, I have both of them, and they can be hard to decipher which one it is. And well, I guess one of these days I might be able to figure out which one's which. Maybe one of these days I'll get lucky and there'll be a cure for one of them. But until then, just gonna keep doing what I know. So that is my update. I go see all my doctors in December. I don't know if I'll have to see my PCP in December, since I'm going to see her this month. And the main reason for going to see her this month is because I'm going to talk to her about IV vitamins. And there shouldn't be a problem with it, because I don't know if I've said anything about this or not, but there are actually IV vitamins given to people for hangovers. So people now are no longer taking, you know, they're just going and getting a banana bag and getting rehydrated to get rid of a hangover. And I want it, so hopefully I'll feel a little bit better, and you know, whatever. So, but that's how that is going on now. Check the internet. So, anyway, that's my update and a little bit of information about my ostomy and all that. So, if you have any questions, please ask me. Don't be afraid. I am not a person that is going to attack you. I will give you the information. If I don't know the information, I will find it out for you. So please subscribe and like, and I'll talk to you guys later. Have a good night.